Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Tamara Lyday, an integrative and family medicine practitioner based in Wisconsin. Thank you for joining us today.
It's great to be here. Thanks for having me.
So tell us a little bit about your practice.
So I have an integrative and functional medicine practice that is hospital-based, which means I am, overseen by a hospital. So it's great because I take insurance and I'm able to see patients of all walks of life, Medicare, Medicaid, and private insurance. I do only integrative and functional medicine despite being a family medicine doctor.
And you're based in Fond du Lac?
I'm based in Fond du Lac, Wisconsin.
Which
yes.
is kind of a rural area.
It is a rural area.
What do you find that people know about functional, anti-aging, integrative medicine?
I was shocked when initially the hospital group I work for decided to put it there. I think it was a space thing. They were like, oh, we have space here? Let's put her here. It's about halfway in between Green Bay and Milwaukee. But the strange part is I have patients from, I think now it's like 31 different states. So wow. Even though I'm in Fond du Lac, I have a patient who flies in from Hawaii to see me. I have patients who come in from Texas to see me. So it's one of those things where as you get good and people talk about your practice, people come from all over to see you. So I don't know if it matters where you are, as long as there's an airport relatively reasonable. So
right. You're a DO.
I am a DO.
And so DOs are typically more holistic in their approach, right? So somebody who isn't familiar with the doctor of osteopathic medicine, could you kind of describe what the difference is?
Right. So we have two schools of medicine in this country. We have medical doctors, MDs, and DOs. The difference being we do all the same coursework as medical doctors. We do all the same classes, anatomy, physiology. We also do what's called OMT, or osteopathic manipulative techniques, which is sort of like, I say that it's a cross between a chiropractor and an MD. So we do all the same coursework, but we also do manual manipulation. So that means that we're able to diagnose and treat people on the table based on their structural findings. So most of us still practice manipulation. I just recently gave mine up just because of my time with patients is limited as it is. So I don't do it, but I do have a wonderful chiropractor who works in my office that we share patients. So right. Yeah.
And so a DO is, just from their background and training, a little closer to this field of anti-aging, integrative functional medicine than an MD might be.
It is.
So what was that transition like for you?
So initially, I think I noticed when I was out and practicing conventional medicine as a family practice doctor, I noticed that there were some patients that no matter what I did, I didn't feel like they were getting better. And so I initially dipped my toe into the quote-unquote alternative health field by becoming an acupuncturist. I thought, acupuncture is great. It's, I could be a medical doctor and still do acupuncture. Let me just add this to my practice. So I did, and I noticed that I was getting some other people well, but there were still a great amount of people that were coming to me and just weren't feeling better. So one of my friends, who's actually a medical acupuncturist with me, said, hey, Tam, I absolutely love this new thing called functional medicine. I'm going to go to a medical conference. I think this is up your alley. Let's try it. So that was my first thing. I have a couple loved ones in my life who are struggling with chronic illness. And I think a lot of times you're edging into functional and integrative medicine is more personal because if you have somebody close to you who's struggling with illness, or it's you yourself, it's just more real and it just hits closer to home. So I went to that first conference, and 3 years later, that's all I do.
When did you discover A4M?
So actually, I had just started getting involved in bioidentical hormones, and I was talking to a compounding pharmacist in Green Bay, and he said, I really want you to go to this convention with me. It's in Vegas. There's this wonderful person, Dr. Smith, who does a lecture that'll blow your socks off. And I'm like, I have never heard of this person. Of course I'll go. So he had me go to this conference. I did it online. I heard Dr. Smith speak, and she kept saying, well, in module 4, you'll learn, or in module 6, and I was like, what are these modules? So I was online, so I typed the moderator, and I was like, hey, what's this online, what is she talking about? She told me about it. I actually registered the next day, and I finished my fellowship within 6 months.
Wow.
Yeah,
that is a fast track.
It was amazing. I literally ate it up. I was actually,
Yeah.
I shouldn't say this, but the learning there was just so on point. I felt like every lecture I could start the next morning and add something to my practice. And I felt like it gave me a lot of the tools that I've been missing in some of my other fellowships.
Yeah, yeah. Because, I mean, typically I think it's around 2 years.
It is. And that's what she told me, because I said I just finished, I had done IFM, I did the Andrew Weil Integrative. I had just done that, and I said, oh, I was talking to Danielle, and I was like, oh, I've just done all these, and she's like, Tammy, you take your time. You can take as much time as you want, but I have an hour commute to work, so I just started listening to lectures, and I learned so much that I just couldn't wait. It was like that book that you can't put down, where you can't wait to get to that last page. So I was so excited about it that I just kept wanting, and then I was done.
So how was it then taking what you learned and applying that in practice to your patient population? Was it a little scary at first?
It's a really scary leap. I had stopped being a family practice provider and kind of started looking for new opportunities and wasn't sure. And I kind of put myself out there as a functional and integrative doctor, even though I'd never worked as one before. So I was lucky enough that my hospital organization wanted to edge towards that type. And so they took a chance on me. And the first day I was like, oh God, I don't know what I'm doing. But the cool thing is there are so many tips and pearls and so many things. Dr. Smith says all this, all the time, what are you going to do on Monday morning? Yeah. And you just take it slow. And the cool thing about it is I find a lot of the patients have been struggling so long with their health that a big part of it is just you're willing to listen and you're not going to brush them off and just give them a pill, spend 8 minutes with them, give them a pill and tell them to follow up, So as long as you're present and you're listening and you're as invested in their healing as they are, I think that everything works out.
Would you say that that's made the biggest difference in your practice, is taking the time to listen? I think
it's being present, taking that time. My initial visit's 75 minutes with a patient. Wow. And sometimes that's not even enough. And back in the day, my initial visit was 30 minutes. So if you just think about that, but when you're talking, I start, my first question is, were you a vaginal or cesarean birth? And they kind of look at you like, nobody's ever asked me that before. Were you breastfed? Oh, I don't know the answer to that. Like they've never been asked that. And you work it all the way up to what kind of traumas have you had? Have you have heavy metal exposure? What do you do for a living? What do you do for fun? It's things that a doctor has never asked them before.
Right. What are some of the typical things that you're seeing with your patient population? What are some of the health issues that they're presenting with?
So I make the joke that the patients I see now are all the ones that I didn't want to see when I was in conventional practice. I typically see a lot of chronic fatigue, a lot of chronic pain. I'm a mold specialist, so I do a lot of molds. I'm Lyme literate, so I get a lot of Lyme patients.
Yes. Especially up there.
Yeah, exactly. Yeah. It's typically, I joke that it's all the patients that I never wanted to see. When you have 8 minutes with somebody and you just slap a diagnosis like fibromyalgia, I see a lot of people that have been diagnosed with fibromyalgia. Well, as we know, that's sort of a garbage diagnosis for we haven't figured out what's really causing you to have pain all over your body. So I spend a lot of time peeling back the layers and trying to determine what the real diagnosis was.
Yeah, and so that co-discovery process, as it were, with the patient, is it something that they're interested in learning as well about their body, and are they somewhat intuitive in terms of what's actually wrong with them?
I always ask people, that's usually like my last question on the first visit, well, what do you think's wrong with you? Because I don't think they've ever been asked that before. Doctors tell them what's wrong, but I don't think, and sometimes you'll get people that are really in tune, people that have been struggling for a long time, and they'll say things like, well, I noticed that when I went to work in that aluminum factory that I just didn't, every day I would come home and it was a struggle. And you might tease out something that typically you wouldn't have known, and you might go down a different pathway, like, okay, well, I'm going to start with some heavy metal testing. That's where we're going to start, instead of doing a typical workup. But it's really fun. I think people buy in when you say, this isn't about me telling you what to do. This is about you and I working as a partnership and us figuring out what it's going to take for your body to heal itself.
Is a lot of it lifestyle as
It's a
well?
lot of lifestyle, yeah. When I first started out, I think I was a little nervous about telling people, because it's a huge change for them. I have a lot of people who come in who are on the standard American diet, and they're very resistant to change. So at first, I'd be like, okay, well, if you don't want to do the diet, well, then I'm, because I wasn't as sure about things. Now that I'm 3 years in and kind of know the score and know that people that come back that haven't adopted the diet and the lifestyle, they just don't get healthy. And everybody wants to get healthy. It doesn't matter that, it's covered by insurance, so there's less skin in the game, but they still don't feel well. And if they really want to feel well, typically when I suggest the diet now, and I kind of say it like, if you don't do this, this is 80% of what's going on.
Yeah.
So if you can't do this, it's going to be really difficult to get you healthy again.
Yeah. Yeah, unfortunately, with big pharma and all the money they spend on advertising, I think a lot of people come to their doctor with a pain or a symptom, and they want a prescription.
They do.
They don't necessarily want to have to make changes in their diet and lifestyle. They would rather have a pill. But it's your job to educate them a little bit in terms of what their options are, right?
Yeah, and it's interesting when you have somebody come in and say they have cancer and they just came from their oncologist's office, and I talk to them about diet and lifestyle, and they'll say things like, I asked my oncologist and he said diet has nothing to do with cancer. And you're just kind of like, ugh, how do you...
Sugar.
Yes, exactly. Like, how do you back out of that without burning any bridges,
Yeah.
Okay, well, I agree to disagree on that one. If it were me and I were struggling with the same diagnosis you had, I wouldn't eat any sugar. I'd limit the amount of meat. I'd do all organic, fruits and vegetables, But it's interesting when they say, I specifically asked that question and I was told the diet has nothing to do with cancer.
Wow.
Mm-hmm.
Yeah. Well, hopefully that is changing here with efforts like A4M and practitioners like yourself, educating other practitioners as well as your patient population. So
It's exciting.
yeah. Thank you so much for joining us and sharing your story.
Thank you so much. It was a pleasure.